Now to the latest on that 16-year-old who fell 3,500 feet through the air when her parachute did not open properly. She's now making major strides in her recovery, and her parents are speaking out.
A Joshua teenager is telling her story 3 weeks after she survived falling thousands of feet while skydiving.
The Johnson County teenager seriously hurt in a skydiving accident in Oklahoma is doing better.
Her face was all over the news. For days, national and international headlines followed her story. 16-year-old Mackenzie Wethington of Joshua, Texas, had survived a horrific skydiving accident.
I think I went into shock. Definitely.
With fractures to her ribs, pelvic bone and spine, lacerations to her liver, and bleeding in her brain, Mackenzie's life changed forever.
Most of our patients have suffered a catastrophic injury or a debilitating illness.
Once her injury stabilized, Mackenzie started an intensive, comprehensive treatment program at Baylor Institute for Rehabilitation. Walking and leg exercises to regain strength and balance. Writing and math to assess and rebuild cognitive function.
If you're getting 20 miles to the gallon, what would you need to know?
Cognitively in speech therapy, when we're working on like math problems, and it's like, it feels like it's third grade math, and I have problems doing some of it.
Consistently recognized nationally for providing compassionate, quality, expert care, Baylor Rehab offers highly specialized rehabilitation services for traumatic brain injury, spinal cord injury, stroke, and other orthopedic and neurological disorders.
The ultimate goal of a rehabilitation program is to maximize the functional outcome of a patient, and that's what we strive to do every single day.
A devastating car wreck led Patty Foster to Baylor Rehab, where a clinical team specializing in traumatic brain injury coached and encouraged her through a tedious recovery process.
I had to relearn the ABCs. I didn't remember how to write ABCs, lowercase, capital. I didn't know how to identify them. So they had to reteach me the alphabet as well as numbers, how to add, subtract, do the basics.
Baylor Rehab's treatment and research in traumatic brain injury has garnered national attention. Our facility has been designated by the National Institute on Disability and Rehabilitation Research as one of 16 throughout the nation to serve as a model system for the care of patients with traumatic brain injuries.
They engaged with me as a human, not a number, human to human. They cared for me in the way their tone of voice and touch and smiles.
I love what I do. You know, there are challenges that make me a better therapist, and there are relationships that get built with not only the patients, but their family members. You kind of get to know them throughout a whole time frame here, and especially the team that I work with. Most of our patients are brain injury patients, traumatic brain injuries, so they tend to be here for quite a few weeks.
Yes, okay.
Physical therapy is just one part of the multidisciplinary clinical approach that helps patients return to full, productive lives. Our team also includes occupational therapists, physicians, nurses, speech-language pathologists, neuropsychologists, and other rehabilitation professionals. Treatment plans are customized to achieve a patient's unique goals. It's a partnership between the patient, family, and clinical team.
Good job. I truly believe that everybody here at Baylor is all about the patients and all about their needs, and we work well as a team, and it's just a great positive atmosphere.
I could sum it up in one sentence. I love this hospital.
Baylor Rehab's commitment to intensive specialized therapy programs is seen not only in the successes of our patients, but is also evidenced in a study commissioned by the ARA Research Institute, an affiliate of the American Medical Rehabilitation Providers Association. The study shows that patients treated in inpatient rehabilitation hospitals and units have better long-term clinical outcomes, go home earlier, and live longer than those treated in nursing homes.
I think the findings represent what we've known for years, that inpatient rehabilitation hospitals and units do a much better job of getting a patient back functioning in their homes and their communities faster and skilled nursing facilities.
At Baylor Rehab, we know recovering from a traumatic injury or illness is more than just taking care of the physical. It's also looking at the individual's emotional and spiritual health. Our staff plays a big part in creating a positive, healing environment.
I feel blessed that every time I come to work, I meet new people, I meet patients that have been through traumatic injuries, and it's my goal as a nurse to get them better. Feel pretty good?
Yep.
All right.
They give me the confidence and the support, and they just kept on pushing me and really helped me through it mentally and physically.
Adam Williamson has found a new outlet for his competitive nature, wheelchair motocross. After experiencing a spinal cord injury, his road to recovery and independence took him through Baylor Rehab. And now to events like this, many staffed by Baylor Rehab volunteers.
All these things are put in place, the volunteers, the helpers, the equipment, it's all here. At the end of the day, when you go home, you feel so good about yourself that, hey, I can still live life and I can still do things slightly different, but there's opportunities out there to be able to have a good time and enjoy life.
In just 40 years, Baylor Rehab has expanded its continuum of care to include 4 freestanding hospitals, 2 acute rehabilitation units, and more than 50 outpatient therapy centers, along with offering home health services. We are the largest rehabilitation system in Texas and one of the largest in the nation. And as Baylor Rehab grows, so does its reputation. U.S. News & World Report has ranked Baylor Institute for Rehabilitation as one of the best rehabilitation hospitals in North and Central Texas. Baylor Rehab has the medical expertise, specialized programs, and proven outcomes that help patients rebuild their lives and aspire to make a difference in the lives of others.
I've always wanted to be a surgeon, and now I know that I want to specialize in trauma so I can relate to the patients more.
It's very important to me to give back what I've been given. Volunteering to me, I could sum up in one word: hope. How often people need hope, and this hospital gives it.
Baylor Institute for Rehabilitation. Changing healthcare for life. For more information, visit baylorhealth.com/rehab or call 1-800-4BAYLOR.